Now, I forgot to ask about this. Something you did. Ukatuambia inaitwa Relactation.
Oh,
Please tell us
yes.
about
Yes. Oh, my
Relactation.
goodness. So I actually did it two to three times, but the one that I was, actively doing it is when my milk dried out. It's been a tough year. I've shared that.
Yeah.
There's been a lot of grief around me. There's a lot going on. And so at some point, my milk dried out.
Okay.
I was away from baby for a couple of days. And when I came back, the milk just ikapunguka mpaka ikaisha.
Hey,
Imagine.
dry.
So number one, I was shocked. I was like, gosh.
Like not again.
Not again.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to enable you to make an informed decision about your health. So the guest I have today is not a stranger to us. She's been here before. And of course, I would not have this podcast without talking about this cartel owner over here. So Dr. Ngendo is a very good friend of mine, and she's been such an inspiration to moms out there. I'll let her introduce herself one more time, and then I'll tell you what the episode is about. So
Thank you. Hi, guys. My name is Dr. Ngendo. I'm a medical doctor. I am a wife and mom of two. I am very, very passionate about all things motherhood and community, and I'm also a breastfeeding advocate. Thanks for having me again.
I was opening the scroll. Are you done?
Yes.
Thanks for being here.
Thank you.
As always, a journey to inside out. Where are you emotionally right now?
I am hopeful.
Oh, what? Say less.
I'm so hopeful.
Really?
Yes.
Okay, about what in particular?
I'm just at a point in my life where I am really looking forward to the endless possibilities.
And there are so many.
There are so many. There are so many. Career, life, friendships.
Wow.
It's a lot. Yeah.
I like that. And I remember the last time we shot a video like a few weeks ago and you talked about being optimistic.
Yes.
So it's good to see that you're still at the same
still
place.
There. Hey.
Okay. Medical jargon. What are you deciphering for us today?
Oh my goodness. Do I have one today?
You don't have
Tell
one?
us one.
Okay. For me, biopsy. Yeah, so what is a biopsy? It's essentially a sample that is taken from your body. It can be a sample of tissue, a sample of skin. It can be a sample from literally any body part that has tissue. And it's taken, it's examined, and by that we're able to determine what condition are we treating and if there is a condition or if there's none. Most of the time it's used in diagnosing cancer. And is there anything else? But yeah, most likely for cancers. Yeah, but that's a biopsy.
Yeah, it's quite scary to many patients.
It is. Have you ever had one?
I've never had one, but a lot of patients that I come across and you tell them that we're going to need to take a biopsy, they get so scared.
It's true because they're like, unanitoa nyama.
Ama unanifanyia surgery. Sasa naenda theater.
Yeah. But most of the time it's a very small piece of, if it's a mass, for example, just a small piece of that mass so they can study that piece and see if there's any potential sign of any condition that needs treatment. Then from there we can make a diagnosis and proceed to treat you. Yeah. Okay, let's get into it. Okay. Your favorite topic. Let me tell you, this girl can yap. Yeah? She can yap about this topic.
All day.
And I'm going to purposely title this episode Ngendo's Second Chance at Breastfeeding.
But that's what it really was.
It really was. It felt like that for you.
It felt like a second chance, honestly.
Okay. Before we get there, do you mind telling us how your pregnancies were? Just because for some people, you might have such a challenging pregnancy, but you really enjoy breastfeeding. For other people, you have a smooth pregnancy, but breastfeeding is a bit difficult.
Yeah.
So how was your pregnancy journey? 1 and 2.
Both my pregnancies were tough.
Oh.
Especially the first trimester. Very difficult. I was on IVs throughout.
I remember. And then she didn't tell us. Remember, we were coming to your house.
Like the first time.
We're coming to this girl's house. We're coming to film Random Doctor Talks. If you remember, you're a real one. And then she's like, But then, first of all, don't wear strong
Like, yeah,
smells.
guys, if you can, like, just don't put on too much
Yeah,
perfume.
perfume.
I'm having allergies or something.
And I think your house had just been painted.
Yes.
Yeah. So now,
Hey.
that whole time, I was talking to a friend of ours called Titania. I was like, but also, do you remember she mentioned this? So let's try to, adhere to that. And she's like, is Ngendo pregnant? Me, I was just there, I'm like, it had
It had not
not
crossed
even
your
crossed my
mind.
mind. I was just like, you've moved house, you're just getting the
Yeah.
house ready. She's like, no, Ngendo is pregnant. And lo and behold, Ngendo was pregnant. And that's how
Imagine.
she told us.
I was having the worst aversions.
Yeah.
Where? It was so bad. Anyway,
Mm-hmm.
first trimester was tough, very difficult. Second trimester for me is bliss. It's like you've just come out of this hyperemesis.
Do you want
And
to explain what that is?
yes, so hyperemesis is a condition in pregnancy where you experience a lot of nausea and vomiting, and can be so severe to the point of needing admission in hospital so that you can get fluids, be able to be rehydrated and feed. It comes with a lot of aversions to food, to smell, to people.
Yeah.
It's a lot. So just after this fades, now it's second trimester, you start feeling the baby kick. Now you're not feeling sick so much. You have energy. So second trimester is good. Still has a few challenges here and there in terms of acidity, some exhaustion. Then third trimester, sciatica, pain all over, you can't sleep, you're peeing every 2 seconds. So second trimester for me is the only one that I enjoy.
Okay.
But yeah,
For both
for
pregnancies.
both, yeah, they were pretty much the same. Just a
Yeah.
few differences here and there, but qua baseline, most of them.
Okay.
Yeah.
Were you really excited to breastfeed? Is this something you're looking forward to?
The first time or the second
Both.
time?
You can give both.
I didn't even think about it before.
Really?
I didn't think it was a thing. I just imagined it's natural.
Oh, yes.
You give birth, you breastfeed. Kwani kuna nini?
Did you go for any of these classes, Lamas? And
I did attend, what was it called? A labor and delivery class. But I don't remember us talking about breastfeeding to that detail.
Okay.
Yes. So for me, it was so natural. I just imagined, in fact, I never conceptualized that people, have to talk and prepare you.
Yeah. So is it natural?
It's not. It's the most unnatural, natural thing to happen.
That is so, it's okay, fine. So now you've had your baby, you've given birth. You're like, oh my God, it's the cutest thing. And then now you have to breastfeed because they're just like, hey, mommy, the baby needs to eat.
Where? Trauma, even PTSD.
Hi.
Yeah. Because first of all, remember my first delivery was terrible.
Yeah, I remember that.
So I'm lying in bed. I am high on medicine. And the doctor walks in with my baby.
Yeah.
And tells me, okay, time to feed. And she puts the baby. Are there nipples?
You're looking for them. Are they in the room with us?
They were not in the room. That was actually the first time I knew that I actually had flat nipples.
And is this just after pregnancy or that was you? That's how you've been?
No, that's how I've been.
Really?
And I never thought about it.
Oh, okay.
Never. So she tells me, hey, sasa hapa tuko na shida.
She tells you like that?
Well, not in those words, but she communicated to me that, we have to do something. And the first thing was to pump a lot because then you're creating the suction, pulling the nipple out, and then keep latching the baby so that they can try and, have that effort.
Yeah.
And then that's when I discovered nipple shields, which for me was game-changing.
What are those?
So it's a silicone piece of material that you place on the nipple, and it has like a nipple shape.
Oh.
So that's what goes into the baby's mouth. And then it creates suction, now draws your flat or inverted nipple, draws it into that space so that now the milk can come out.
Also, it just mimics.
It mimics your
Kind
nipple,
of.
basically. Yes. Yes.
then?
Very helpful.
Really?
So I got that, started pumping. I didn't have milk immediately. I'm still dealing with my trauma of delivery. Where?
It's a lot.
I don't know how I got out of that hospital sane.
Yeah.
It was a lot. Hey. Anyway, milk eventually came in. I think the
After
day,
how long?
like 3-4 days.
Okay. So you went home with the baby and there was, like, how was that period, like, before it came in?
Because we were still in hospital, the baby was being
Okay.
given formula. Initially, they started with glucose. D10.
Yeah.
And then they moved on to formula.
Okay.
But I requested, I was like, surely maybe we can't be on glucose for a whole week. Like, it's fine. Just give
Yeah,
them
just give them-
formula.
okay.
Yeah, so my ped was fine. She said it's okay, calculated, Nini. Slowly, now my milk started coming in.
Yeah.
Mm.
And now, how was that first? The first 20 days, you know, with the new needs, you're trying to adjust.
Hey,
And then breastfeeding was already not natural to you.
Gosh, it was something else. I
can see you thinking about.
I'm trying to remember because some things you just put aside.
Yeah.
But I dealt with a lot of anxiety because of my delivery process. I had so much anxiety still of, is my baby okay? Is my baby going to be fine?
Yeah, that's
so
true.
actually, funny story. I think day 11 of life.
Of life.
Baby is fine, but you know, newborns sleep a lot.
Yeah.
And they're generally just calm. Hawana mambo mingi. So my husband needed to travel just for the day. Just that morning and coming back in the evening. Let me tell you, the minute he walked out the door, palpitations.
Just like, yeah.
Hey, suddenly I'm looking at my baby. She's too sleepy. No, there must be a problem. There's a problem.
Did you do those things for
all the time.
Really?
I even undressed her. I'm like, you're not breathing. What's going on?
Wow.
So newborns, actually, this is now, I remembered, newborns go through periods of apnea, which is short periods when the baby is not breathing. So it should not last more than 20 seconds for sure. If it's more than 20 seconds, it's a problem.
Yeah.
Was I remembering that at the time?
In fact, you told me something. Remember when I was asking you, do you feel like all the medicine you had done like left your brain?
Out the wind. It was not with us. So I called my mom. I didn't want to make my husband panic.
Yeah.
So I called my mom, like, Mommy, there's a problem with the baby. I don't know. She's not breathing.
Wow.
I've tried giving her milk. She's not taking it. But my mom was so chilled.
Yeah.
She's like, hey, oh, okay.
You're just like, it's a sense of urgency, please.
So I called my doctor after that. My doctor didn't answer, so I sent her a message.
Yeah.
I was like, this is the problem, blah, blah, blah. She only asked me 2 questions. Is the baby feverish? Like, what's the temperature? And has the baby pooped? I was like, yeah, temperature is fine. And we are pooping like 3 times a day. After that, she blue-ticked me.
You're just like, when you think, man, a baby who's not breathing is pooping. You know how?
She was just like, now the next day when I went to see her, she was like, yeah, I knew there was nothing wrong. So anyway, me, I was still panicking.
Yeah.
I told my mommy, please come. Just come. Mommy, I'm not, please, just come. I'm not okay.
Yeah.
At this point, I'm in tears. I don't want the nanny to see that I'm crying because she'll be like, Sasa, wewe uko na shida gani?
Mom, is everything okay?
But eventually my mom came.
Yeah.
Hey, the baby was so fine.
That's when the baby woke up.
That's when the baby woke up and gulped down milk like no one's business. Whew, so there was that anxiety. But I can say I had really good support. So it helped.
Yeah.
Yes.
So when did you stop? Okay, you breastfed until how long for your first baby?
The first baby. So we actually did a mixture of breastfeeding and formula feeding.
Okay.
Because remember, my milk took some time to come. And when it came, it was not a lot. It was just barely enough. So we supplemented with formula.
Okay.
And of course, as a first-time mom, I was unhappy about this naturally because I felt like I needed to breastfeed my baby purely. But I think my husband just really encouraged me. He was like, honestly, let's just give the baby what they need.
Yeah.
Don't stress yourself. Because now even whatever little you have is going to disappear.
Exactly.
So we ended up doing a mixture of breastfeeding and formula feeding up to about 5 months. So I went back to work at 4 months.
Yeah.
Toxic. The most toxic period of my life. So naturally, maziwa ikakauka.
Oh yeah, because of the stress.
Because of the stress.
Yeah.
So slowly it started diminishing from 4 months, but by 5 months there was nothing, zero.
Not even a drop?
Not even a drop.
What?
And I tried everything. I was drinking 4 liters of water a day. I was eating like mtu wa mjengo.
Kama kawaida. This girl eats, let me tell you, she has a good appetite.
Just because of breastfeeding.
Yeah.
So I tried even pumping, you know, the 3 every 3 hours.
Yeah.
Nothing worked.
Eh?
And then that's when I went to my doctor and I just broke down. I told her, this is not working. I feel so bad. She just told me, no, there's no trophy for breastfeeding.
Say it louder, please.
There
Just say
is
it
no
louder.
trophy for breastfeeding. So do what you need to do
Yeah.
to keep this baby alive and to keep you well.
Thank you.
From there, it was just formula.
Wow.
Ikaisha tu hivyo.
And was there anything, did you find any challenge breastfeeding during the 5 months? Like maybe your nipples were cracking?
Yes, I was in pain. Yeah. Especially the first 2 weeks. I literally used to hold a pillow to my face because I was screaming and I didn't want to scare the baby.
Kai, why?
The pain.
Is breastfeeding painful?
It is. It can be. Ideally, it should not be, but it can be painful. And there are several factors that can cause the pain.
But tell us.
So, for instance, poor latching, which was our problem. If you're not latched well, the baby is going to be sucking on your nipple instead of the breast. That's why it's called breastfeeding, not nipple feeding. So we were nipple feeding. Wow. But then there was also so much drama because of the nipple shields.
Yeah, I can imagine.
Okay. Anyway, so that's one of the reasons. Another reason why you can feel pain is if you have an infection called nipple thrush. And this is actually really overlooked. So that's why I encourage all moms to speak to your doctor. If you're having any kind of pain when breastfeeding, speak to your doctor. So the nipple thrush, you might not actually even see anything. So you don't have cracked nipples, it's not bleeding or anything, there's no white. You're just in so much pain.
And does the baby have any signs?
Yes. Okay. Now, when you examine the baby is when you notice the baby has thrush, and that's what was passed on to the mom.
So who did it came from? The baby?
The baby. The baby. Remember, they have low immunity, so they develop thrush quite easily. Yeah. Another reason is if you have engorged breasts. That's why you're encouraged to keep removing every 2 to 3 hours initially. Keep removing the milk, whether it's by breastfeeding or pumping. And engorgement can lead to blocked ducts, which can lead to mastitis, which is an infection. So it's a whole cascade.
Remember when you had blocked ducts?
Ooh, don't remind me. Don't remind me.
Hey, the way you just described it, I was just like, guy.
It's
It's
comparable to labor. Yes, it's bad.
So what did you do about them?
It's so bad. The treatment is massaging.
Yeah, just
massage the lump to get out. Hakuna kitu ingine. Take painkillers to ease the pain. You can do cold, compress, or even warm. I find warm that really suits the breast. What else do you do? Yeah, keep pumping and keep breastfeeding.
Now for me, the thing is, my boobs are paining. I think you're telling me keep the child breastfeed.
Or massage.
Or pump.
Imagine.
Everything is inflicting more pain.
That's why it's so painful.
You guys are so strong.
Where?
And I keep telling Ngendo, you're walking so the rest of us can run. Even fly at this point.
Yes,
even fly.
You better fly. I'm not doing all this for nothing.
Let me ask, do you think that if you are empowered during your pregnancy that you don't really have to breastfeed if you feel like you don't have the milk or there's some certain challenges that you're facing and formula is also another option? Do you feel like you would have given yourself some grace?
I think so.
Okay.
Yes. Okay. Because a lot of information that's out there is breastfed is best. But I think we're moving away from that. A fed baby is best.
That's true.
Yeah,
that's
because you're going to kill yourself now trying to breastfeed this baby when there's another option. That's true. There are so many benefits of breastfeeding, and I am 100% an advocate of breastfeeding. But if you can't, for whatever reason, or if you choose not to, because there are also women who choose not to breastfeed, there's an option.
So they pump and dump, or what do you do with the milk?
Either pump and give by bottle or give formula.
Actually, now it's good you see that. Is pumping and feeding by bottle after you've pumped still considered breastfeeding?
It's still considered breastfeeding.
Okay.
Yes,
good,
it is.
Good.
Yes.
Okay. So we've talked about baby number 1, and then number 2 came, and all of a sudden we have a champion. Let me tell you, this girl, she had freezers full of milk. I need to insert pictures here because I used to look at that and I'm just like, this cannot be normal. So now, where did it change, or what happened differently that now your second pregnancy, it's like you had
think it was a miracle. Supply. Honestly, God was like, I'm going to give you a lot of milk so that you can educate other people or help other people. Because I can guarantee you, if that was not the case,
Yeah.
I would not even be at here on social media. My first baby, you never saw her.
That's true. That's
So
true. You used to put remember the emoji.
there's no amount of, like, you could not have convinced me
Yeah.
to share my
Your journey.
my private life. But then when this happened,
Yeah.
I was like, wow, kumbe it's possible. Let me
Mm.
just encourage other
Yeah.
women. It was a miracle, truly.
Mm-hmm.
And I was not expecting it. In fact, I had carried formula in my delivery bag.
Remember?
Formula, even bottles. I was
Yeah.
ready to give this baby formula.
Uh-huh.
But lo and behold, day 2, my milk came in abundance. When I tell you the taps were opened, in fact, the day I got home from hospital,
Yeah.
I was engorged.
Hiya.
Yes, that's how much it was. And then, early stages, the baby's not feeding a lot.
Yeah.
So they'll feed. They're removing maybe 20 meals. That's what they need.
Yeah.
Where's the rest going? They're so small.
Yeah.
So I was engorged, and that's now what led me to start pumping actively.
Like it was a championship. Where's the camera? It was a championship. Let me tell you, Ngendo was just like, by the end of 3 months, I'm feeling this freezer.
And you know what?
Full.
It was not even intentionally
Yeah.
at pumping so that I can have a full freezer.
Yeah.
I was just, if I'm engorged, I need to
You
pump.
must.
I have to
Yeah,
pump.
Exactly.
And then it helped me because there were still some days in postpartum where you don't feel like you have the energy or the mental capacity to even pump.
Yeah.
So on those days, you know that you have a cushion.
Oh, yeah.
So you know that if you're going back to work, for example, I'm going back to work at 3-4 months.
Yeah.
I know that I'm not going to be very stressed when I go back about what my baby is having.
Yeah.
And I feel like it's unfair. Humans are the only, I don't know, animals or primates that have to pump because they're not with their babies. All other animals walk around with their babies throughout.
True.
Yeah, so primates are the, humans have to, we are torn away from our babies when we have to go back to work.
That's true.
I find it so unfair, but it is what it is.
It's like you've forgotten we're animals as well. Okay, so now what made you start sharing your journey? Like, what was the aha moment? You're just like,
Yes.
no, I think someone really can benefit from
Yes.
this and I should share.
So I was in my bed, and I put out a post. I think at the time I had like maybe 70 followers. Just, you're a small community. I was very private. And I put out a post of me leaving hospital, saying, oh, I have my, my baby came, blah, blah, blah. And I got so many messages just being like, oh, please share your story with us. And that's how it started.
Okay.
So I just started, posting, sharing my breast milk, my experience postpartum, and that's how I'm here.
Okay. So now I'll ask you a question. Let's have a small fun segment. Pumping or baby to breast?
It depends.
It depends on what?
It's this or that. Gosh,
Okay, what does it depend
tough.
on?
That's so tough. Because I have loved breastfeeding. If you had asked me this,
your first pregnancy?
my first pregnancy, I'd have said pumping or even none.
Hey.
Just because it was so difficult.
Yeah.
But now I've really enjoyed breastfeeding.
Yeah.
So I would say breastfeeding.
What particularly did you enjoy about breastfeeding? Like, how did it make you feel?
The bond, I think.
Yeah.
So just my son looking at me.
Even just like, the boy.
My son looking at me, and then he stops breastfeeding, and then he starts again, and just the eyes, that contact. I really, really love it. And then it's very convenient.
Okay.
As opposed to, preparing a bottle, sterilizing it, preparing, measuring, People don't talk about also the difficult part of pumping because it's not easy.
Please tell us more.
It's also not easy. Okay, number one, washing all those
First
bottles.
of all, which one there's manual, there's automatic?
The pumps are so many.
Yeah.
There are so many. But what worked for me this time round was the portable ones that you just put in your bra. I could be pumping right now for all you know. And you're able to go about your day.
Remember the event we went for and you're just sitting there. I was just like, this is so crazy.
Imagine, you can pump anywhere. Anywhere.
And you're not connected to anything.
Yes. So that's been really helpful for me because I remember the first time round, something that used to deter me is thinking, gosh, now I have to sit down for 30 minutes tethered to this chair because I'm holding the pumps. If it's connected to the socket. Where?
Did you ever do the one
The
for
manual?
Yes.
Yes. Manual pump is amazing.
Really?
Yes. Love it. Apart from the getting tired, it's really good.
In fact, you'd have to be doing like some hand exercises.
Yes.
Okay.
It's good. It extracts milk well, and then it's inexpensive.
Yeah.
Yeah.
Oh, that's
and
stupid. And easy to clean.
Portable. It's easy to clean. It's portable. You can carry it anywhere.
So what's difficult about pumping? Because you see sometimes there's some difficulties or challenges.
Yes. So there's that. It's the pumping parts you have to carry around everywhere. That's extra baggage.
Let me ask, do those pumping packs, the where you transfer the
milk,
the packs, do they come with the whole kit or you buy them separately?
No, those are bought separately. Yes.
Na mnasemanga mtoto anakuja na sahani.
Yeah, anakuja nayo. But it's expensive.
Yeah.
People say, oh, you chose the cheaper option. Breastfeeding is cheaper. There are still costs.
That's true.
Yeah, so there's that. There's the sterilizing because you have to make sure that you're giving your baby the best.
Yeah.
It's time consuming because you have to pump, for at least 20-30 minutes every session. You have to do about every 3 to 4 hours. So it's very tiring.
And even the storage of the milk. Remember you're asking, where do I get blocks of ice?
Yes.
And I'm just like, blocks of ice.
Imagine. There's so much that goes into it that you don't think about until you're in that moment and you need it. Yeah.
Okay. Then now, let's take a turn, kidogo. What did you not enjoy about breastfeeding or pumping?
What did I not enjoy? Honestly, I can say that for me this time, the only thing I didn't enjoy is how exhausting it is.
Okay.
Yeah. It's super tiring.
Yeah.
I used to wake up at 3 a.m. like clockwork every day.
For how long?
For about 6 months.
What?
Yes.
Okay, so you'd breastfeed 3 a.m. and then the next
at 3 a.m. I was not breastfeeding. At 3 a.m. I was pumping.
And then?
At 3 a.m. my husband was giving baby a bottle. Which kudos to him as well because it takes teamwork. So because 3 a.m. or middle of the night pump produces more milk. Okay. So that's why I chose to be pumping at that time. And then baby can get a bottle.
Is there a particular reason why you produce more milk at that time?
Yes, because your prolactin levels are higher. So it varies with your circadian rhythm. Okay. So at that time, your prolactin is high, so you're producing
more milk. Okay. So 3 a.m. and then the next time is that? Now breastfeeding or pumping?
Around 7.
Okay.
Yes. And then this is now when I'm on mat leave, when I'm not at work. Yes. So baby is up at 7, breastfeeds. And then now it's my shift. Daytime was my shift because my husband was up pretty much all night with the baby. Now it's my shift. I take the baby. We either bask or just go for a walk or just chill in the house and bond, just talk, Nini. And then he sleeps for maybe 2 to 3. Thankfully, I have good sleepers. But also sleep training plays a part in it. So sleep for about 2 to 3 hours. He wakes up, it's a routine. Wake,
clockwork,
feed, play. Yeah. So when the baby wakes up, feed the baby when they're alert, and then play with the baby. Then they go back to sleep. So that's just the cycle.
Yeah.
Yes.
Wow. Then I remember you also started taking some supplements.
Yes.
To improve your milk production. Tell us about that. I tasted them, guys, and let me just say, I'm sorry, but...
No, but didn't you like them?
No.
Hoopy.
No.
Are you sure?
No.
That's what you said.
No. Okay, I just feel like they needed more sugar. That's it.
You sweet tooth.
They just needed more
That's
sugar.
the only reason.
That's the only reason. Just more sugar and they would be A1.
Okay. So I actually took them to hospital with me.
And wait, also, why didn't you do that for the first pregnancy?
I did.
Oh, you did?
Yeah, but they just didn't work. Okay. When you have stress and all these other... confounding factors. No matter what you do, the milk is not going to come. It's not gonna come. But this time, thankfully, it came. So I took the products with me to hospital. I had to hide them because the hospital I was in, they don't allow anything from outside. So I'm there in my car drinking chocolate. I'm adding a teaspoon of the tea. So basically, you have the lactation teas, the muffins, cookies, and what they are just galactagogues, which are things that stimulate milk production.
Yeah.
They've been put together, plus now oats, flour, all this, to make something yummy that will encourage you
To eat.
to eat.
Okay.
Yeah. But remember, they only work if you have a good foundation.
Okay.
Yes.
Tell us, what is a good foundation?
Good foundation. Number one is diet. Yes. So you have to be eating a healthy, balanced diet.
Do you get because you are eating a lot,
Yes.
and it's like you weren't getting food, you are so happy to eat.
Yes.
Does breastfeeding make you like
Where breastfeeding
gives you
hunger
energy?
and breastfeeding thirst, I say, is supernatural.
The thirst
You
is so
can't
weird.
even describe it.
Yeah.
It's crazy. It's like you've just run a marathon
What?
and you can't get water. It's like a strong desire for water. It's like a craving. So there's that. There's the diet. There's good hydration is key.
Okay.
So we recommend at least 3 liters of water in a day, but also remember
How
to
many?
add 3, because breast milk is mostly water.
Wow, that's true.
Think about it.
Yeah, it's mostly
If you don't have water in your body, if you're dehydrated, you're not going to be able to produce
enough
breast milk.
Yeah.
Where is the water coming from? So 3 liters, but remember you also need electrolytes in this water. And then you can do other drinks as well. Your chocolates, which I love, your soup, porridge.
Yeah.
But the soup and porridge thing is a myth. Okay.
It is.
Yeah, it's
But you
a
can't
myth.
put those things
It's
in the
just
porridge
about
and
hydration.
Njahe is another one.
Yes. That's more of an African thing, a culture.
Yeah.
More so Kenyan.
Okay. So it's placebo.
It's placebo. Because do Wazungus have njahe?
No.
Do they drink porridge?
Well, I don't know.
They don't, and they still produce a lot of milk.
That's true.
So it's about being hydrated. What is the other thing? You need to rest.
That's true.
Yeah, rest and breast milk production they're like this.
Yeah.
So if you're not resting enough, your body is not going to be able to produce enough. And sleeping as well.
Yeah.
Actually, there are studies that show that women need more sleep than men.
I agree.
Which is why now you need to also have a very supportive partner.
Yeah.
Because you need the time to rejuvenate. A friend of mine who we gave birth around the same time told me she was getting hallucinations because she was not sleeping. Like actual hallucinations, Hopi. The ones we ask patients, are you seeing something that's not there? For real. And that's because she was up every hour.
Was she
I think I'd have died
parent at that point?
She was not, but I think just the schedules were not aligning.
Yeah.
Yes.
What?
I would have died.
Yeah, that's the
1
end.
hour. Waking up every hour.
Hey, and then hallucinations. I'm sorry, but what?
Yes.
Hey,
that's how serious it is.
crazy.
Yes. So you definitely need good rest, and you need to also have a schedule that works for you. So very early on, you need to create a pumping schedule so that you can maximize from when you're home.
Yeah.
You need to be intentional about it, because don't just go home thinking, I'll pump when I pump, or I will, breastfeed and then it'll be natural. It's not natural. You need a schedule.
And now that you've said schedule, let me ask, if you're pumping and breastfeeding together, when do you do? Which one comes first?
So for me, what I used to do is I would, if the baby is awake, I'll feed the baby.
Okay.
And then 20-30 minutes of feeding, mtoto ameshiba, pump.
Okay.
So I would wait 30 minutes after feeding and then pump.
Okay.
Also, something else to note is that prolactin levels are at their peak 30 minutes after a breastfeeding session. So when you initiate breastfeeding, 30 minutes from then, if you took samples, prolactin will have peaked.
So pump.
Yeah, because it's your body telling you that you need to produce more. So the baby is feeding now, your body is telling you, it's time to produce some more, because whatever is here is being removed. Yes, so I would feed and then pump. But now I still used to keep my pumping schedule such that even if the baby wakes up and I've just pumped, I'll still put the baby to the breast. They extract whatever it is, because it never is, removed completely to the point that there's not even a single drop. And then after that, they can get a bottle.
Okay.
Yeah, if they're not full, they can get a bottle.
Okay.
Yeah.
Is there any reason why you would breastfeed first?
That's just if the baby's awake and it's their feeding time.
Okay.
Yes.
Then tell us about breast milk. Remember that we were told hind milk, for milk?
Yes.
Will you tell us about that?
So initially, when you've just given birth,
Yeah.
the milk that's produced is called colostrum.
Yes.
And this is normally very high in fats and antibodies. And
Just
then,
good things for the
yes,
baby.
yes, yes. And then slowly, as time passes, you start to produce now more mature milk. So about day 7 to day 10, the milk now starts to become mature, and it takes a couple of weeks for it to actually mature.
Okay.
And at the start of a breastfeeding session, it's more watery.
Yes.
That's now for milk
Okay.
to quench the baby's thirst. And then at the end, it's more hind milk, which is more rich.
Nutritious.
Yeah, it's more nutritious, rich in fats, proteins, and all that.
Okay.
Yes.
So why I asked that is because what is the standard time that someone should breastfeed for? Because if you're just giving the baby for milk, then you're just hydrating the baby, but you're not giving the baby nutrients.
Yes.
So how long should you breastfeed
That's
to
a
see
very
that
good
the
question.
baby is well fed?
Yes, that's a good question.
Yeah.
And why I say that is because babies are different.
Okay.
So I know practice,
Yeah.
we teach moms to breastfeed for 30 minutes.
Okay.
That's standard practice. But imagine some babies, after 15 minutes, they are done. They are done, and you cannot convince them
so
to take
wamekunywa tu
more.
maji?
No, not necessarily.
Okay.
They are still getting some of that.
I'm going to ask you a dumb question. Ama, you shake the breast like this? You're like, it will mix in there.
Yeah. Hey, that's funny.
Oh my goodness. Okay, but thank you for elaborating. You can
Yeah, so
continue. I think
don't
you still have some more
force,
to
don't
say.
force at your baby. You must stay on the breast for 30 minutes.
Yeah.
Ideally, it would be good, but if they are full and they release the breast, because children are smart and they communicate with us.
Yeah.
Now they've released you, you're forcing them.
come
Surely,
back, come back,
surely.
come back.
Even you, ukishiba si unaacha kukula.
Yeah. Okay. Now, honest to move to a different point, you have really become an advocate for safe breastfeeding spaces for mothers.
Yes.
Tell us more about that.
Oh my goodness.
Yeah.
Now, the fact that we have to go back to work just means that you need all the support you can get at the workplace.
That's true.
To be able to continue breastfeeding. Because remember, WHO recommends 6 months of exclusive breastfeeding.
Yeah.
That means no water, no porridge, no food.
Let me tell you for a fact, by the way, even me as a doctor, when they said exclusive breastfeeding, like I had never thought about water, but I just didn't think water was also an exclusion. Like you're just like, yeah, no
It
water.
is. The breast milk has water.
Yeah. Okay.
So the fact that we need to breastfeed exclusively for 6 months, but we are going back to work after 3 or 4 months, means that you need a
Support,
space at your workplace where you can actually comfortably do it.
Yeah.
This thing of mothers expressing in the toilet, in just
First of all, the toilet is
random
so
rooms, it
unhygienic.
is actually
It's wrong.
at my workplace. There's a mom who contracted a diarrheal illness and passed it on to her baby.
You know, I'm not gonna say much because that's a hospital. But okay.
Imagine, so imagine if we are like that.
Yeah.
So what about non-healthcare facilities? So that's why, in fact, when she told me that, I was even more determined to make this happen, because the amount of stress we go through when we're at work, away from our babies, wondering, have they fed?
Yeah.
Are they okay? Do I have enough breast milk? What if the one that's in the fridge is over? What will they have tomorrow? You know? And then our formula comes at an extra cost.
Formula is expensive.
Wow. And then they want to tax it even more.
Still, they're still on that agenda.
Where? Yeah, so I'm on the path to creating more of these spaces at different workplaces. Okay. Yes.
What is the definition of a safe space for a breastfeeding mom or a pumping mom?
Or a pumping mom. Yes. So number 1 is a designated room, just for that.
Okay.
So don't tell me to go pump in the conference room because there's nobody using it at the moment. Is it sterile? How many people have been in that room? Number 2 is privacy. I need to know that I am in a safe and private area. So even within the room, there needs to be dedicated spaces where you can actually pump in private, such that
Like
even if,
booths.
yes,
Okay,
exactly.
okay.
Like even if you're 4 or 5 women, multiple of you can pump at
Yeah,
the
at the
same time.
Yeah.
And then it needs to be clean, obviously. And that's why it's important for it to be designated such that it is being looked after in a different way from any other, like an office or,
Yeah.
what else?
The
It
fridge.
needs to be, yes. You definitely need a fridge because how are you going to store your milk? You need a comfortable seat because you can't be pumping and you're bending. Remember, like
Yeah.
in Mashinani, how the moms used to
Hey.
express. It's
Yeah,
so
like
tough.
these.
Yeah. It's
Yeah.
really tough.
Okay.
So you need to be comfortable. You need to have, other amenities like, do we have a
Yeah.
microwave so that I can eat as I'm pumping? So that my whole break, you can imagine you've been given.
Actually, yeah, that's your break.
Yeah. Instead of relaxing or resting, you're doing even harder work.
That's true.
So you don't even have time to eat, to hydrate. So there needs to be all that in one space.
Okay.
Yes.
That makes so much sense. I remember I had a colleague who came back from maternity leave and she was given now, it wasn't a designated space, but it was a room that we'd call, it was a room where people would go to brainstorm. So anytime she'd want to breastfeed, she'd close the curtains and then she'd put out like a sign over there. And I just used to enter because she'd call me sometimes just to ask some questions. And I just ask her, "Are you comfortable? Like, are you okay?" And she just wasn't.
Yeah, you can't be.
She really was not comfortable. So that's really a commendable job.
Thank you.
Okay.
Thank
Please
you.
continue.
I will.
And anytime you want to come and talk about what you're doing, maybe what I want, please.
I will.
Come
I
here. We
will.
talk about it.
Yeah.
Now let's go back to this and that.
Okay.
Okay. So now, when it comes to your snacks, your breastfeeding snacks, which one was the best? Jenny, the one you're just like, when I eat this thing, one, it's yummy. And then number two, the milk is just in endless supply. Is it the cupcake? Is it the
It was cookies.
The cookies.
For me, it was the cupcakes.
The cupcake.
I love them. Loved.
Which flavor? I remember there's a flavor you liked in particular.
Chocolate.
The chocolate
yes,
one.
Yes,
Okay,
yes.
plug first of all your
Lactacare Kenya have the best lactation products. They're so good. And then for you who likes sugar, you can tell them, please add some sugar. It's not healthy.
My only request. No. My humble sugar is healthy. Excess sugar.
Sasa hiyo ni excess.
Nani amesema ni excess? Who has said it's excess?
Juu kama kwangu ni sawa, mbona unataka
I didn't
ingine?
taste any sugar. At a drop.
You felt like it was.
Not even a drop. It's called a granule.
And then there are people who now want less sugar than that.
But then I think they can.
Yeah, so they're able to tailor make it.
Which is nice. Which is nice. So Lactacare, we've given you a shout out. Please treat the people nicely.
Yes, they do. They really do.
Sawa. Next question: night feeding or early morning feeding?
Early morning.
Or pumping? Early morning.
Feeding early morning, pumping usiku.
Okay. Is it because of the timings, like now prolacting, or just you
also just my schedule,
okay.
How I planned myself.
Okay.
Yeah.
Okay. Then another one is, Sasa, nursing covers. Are they stylish or are they practical?
Nursing covers.
Yeah. Nipple covers. They're nipple covers. No, actually, it's nursing covers. You know,
the ones for covering when you're breastfeeding.
Yeah.
Never did that.
The thing, it's like a cloth. It's like a pad. For people, I don't see people. You know, sometimes you leak.
Oh, yes. The bra pads is what you mean. Yes. The nursing pads.
Nursing pads.
Are they what or what?
Stylish or practical?
Practical.
Did you wear any?
Yes, all the time.
Yeah.
All the time.
First of all, did you ever leak like in public?
Yes.
Where you're just walking around and you're just like, ooh.
Yes. One day I forgot to wear and I was at work and I was just dripping and I was like, I don't care.
You know I'm breastfeeding.
I'm doing what I'm doing.
Yeah. Okay. Now, because you just took a vacation. So location as a mom or family vacation? Your family is not watching.
Solo. I love you, kids.
Why solo? Elaborate.
As a mom, it's so difficult to get time just to yourself.
Yeah.
Because even when you don't have your kids, you're still, either thinking about them or planning, managing the household, there's shopping that needs to be done, the nanny needs to be paid, the nanny is going on leave, you need to schedule all that. But when you actually take a vacation, you leave all that to somebody. Like, only call me if the house is on fire.
Do you define what being on fire is?
Literal fire.
So why I asked that is breastfeeding can also be a stressful situation for
Yes.
a mom.
Yes.
So did you take time for yourself during your breastfeeding journey where you're just like, I just need this time for myself? Maybe you go for a massage, you go for even a walk, like you just do something for yourself. And did you find them
Yes,
helpful?
very helpful.
Yeah.
Yeah. So I used to try and do walks quite often. I also used to just leave the house sometimes, go sit in a restaurant, read a book,
Yeah.
just to be away from that environment and also to interact with other adults because when you,
hi baby, how are you? Oh my gosh.
where it can get to you.
Yeah.
Yes.
Okay.
So taking time for yourself,
Yeah.
mandatory.
Okay. So Amesema, highly encouraged.
Yep.
All right. Now, as we wind up, you breastfed until 1 year, 4 months.
Yes.
Let me clap for you.
Yes. Actually, I've just stopped breastfeeding
Let me
now.
clap. Uko sure?
I'm sure.
Sure,
It's
sure,
been
no
over
doubt.
1 week. We're not going back.
If milk comes out now,
No, it's okay. It will come out and then.
Okay. So now, how does it feel to actually have crossed the? I know 1 year. You had really wanted to pass 1 year. Your
Yes.
target, I know, was 2 years. But
Yes.
how do you feel having reached 1 year, 4 months?
Where it was such a relief. I was like, I have done exceedingly abundantly
Beyond my expectations.
beyond my expectations.
Yeah.
So even 6 months, by the way, I would have stopped
Okay.
if I, either had challenges or
Yeah.
decided to. I would have stopped because now baby can eat and there are other
Yeah.
things to be given.
Like hata
But
kufa, she'll be fine.
yes, hey, so even reaching 1 year, I was like,
Yeah.
wow,
You keep
wow,
yourself.
hey, it's a lot. So the number of times that you
Yeah.
consider quitting, but then you just keep going.
I have
going.
one question, but before that, what's the highlight? Like the one thing you're just like, either I really missed that, or you'd like to like put it in a memory box when it comes to your breastfeeding journey.
I think it's seeing my baby looking at me after he's finished breastfeeding and he's satisfied.
Oh,
He's just ameshiba too.
he's just like, I'm just happy to be
he's
here.
just
Saki,
happy.
Saki, I'm just happy to be here.
You've seen that meme for bora wameshiba hawasumbui.
Yeah, yes.
So
and
for
it's
me,
true.
yeah, it's true.
First of all, is there a thing about overfeeding babies?
Yes.
Tell me about. There's a time I was feeding my niece, and this girl has such a good appetite, and she just kept on eating and eating and eating. And me, I was just there. If the baby wants to eat, see, we just give the baby food. I'm saying, but now she could like feed like properly. It wasn't milk. My aunt was just like, do you know you're not supposed to overfeed babies? Me, I didn't know.
But if she's asking for it, I wouldn't really call it overfeeding.
No, she was eating like an adult's portion.
Is she obese?
She was a big baby.
Obese?
Not obese.
Yeah, there's a difference between big baby and obese.
She's chunky. She's a chunk.
Me, honestly, I say as long as you're on the graph, as long as you're not obese, it's not overfeeding. Okay. Because babies are different. Yeah. They will ask for it. Yeah. And if the appetite is there, do you know the thing that stresses mothers the most when it comes to weaning is your child refusing to eat.
And now this one wants to eat. And
so if you have a good appetite, hey, just feed that baby.
Okay. Okay. Now, I forgot to ask about this. Something you did. Ukatuambia inaitwa Relactation.
Oh, yes.
Please tell us about Relactation.
Yes. Oh, my goodness. So I actually did it two to three times. But the one that I was, actively doing it is when my milk dried out. It's been a tough year. I've shared that. Yeah. There's been a lot of grief around me. There's a lot going on. And so at some point, my milk dried out. Okay. I was away from baby for a couple of days. And when I came back, the milk just ikapunguka mpaka ikaisha. Hey? Imagine. Dry. So number one, I was shocked. I was like, gosh.
Like, not again.
Not again. Not again.
Yeah.
But this time, because first, my workplace is a lot less toxic than the initial one. Okay. So I had good support from my colleagues. I had good support from my husband, from the nanny. I have an amazing nanny.
I've met them.
Yes.
Ooh, she's so good with the
and
kids.
that actually really plays an important role. We don't talk about it enough, but a lot of breastfeeding moms will tell you that's a point of stress.
Okay.
So because everything else was working for me, I said, I must relactate. I have to, because remember, my goal is 1 year.
Yeah, minimum.
Yes.
Minimum 1 year, yeah.
So I did. I dedicated time. I had to take time off work because it's rigorous. It's not easy.
That's true.
Yeah, it's not easy.
Yeah.
So I actually took time off from work specifically to relactate, which means trying to get your body to now produce milk again.
Okay.
And it worked.
Was there anything in particular you were doing?
Nothing out of the ordinary. It's the same things I've mentioned.
Okay.
Have a schedule and stick to it. Use a pump that works for you.
Okay.
Eat well, hydrate, rest enough, sleep, and take care of yourself.
All right.
Yes. Oh, then I also got medicine.
Medicine?
Yes, I had to take some medication, Motilium.
Okay.
Yeah, because like literally there was nothing. There was not even, and it was 2 drops. If you see some of the pictures that I shared, there's one time there was literally like 2 drops.
You're needing the bottles for us.
So yes, my doctor prescribed some medication and it helped.
Okay, and at that point, you had started, one of your relactation episodes, you started going to the gym and then you stopped.
That was another factor.
Yeah.
For me, gym reduced my milk supply. For some people, it won't affect it. For some others, it will even increase. But for me personally, it reduced. So I had to stop.
That's interesting.
Yes.
Wow, thank you. I think we can go on. Thank you so much for coming.
Thank you.
But before we go, I want you to do 2 things. Just 2 things.
Oh gosh.
Number one, what is one word of encouragement you'd give to a mom who's maybe either just about to start her breastfeeding journey or is having a difficult time breastfeeding? Yeah.
So for you who is having a difficult time, I see you and I completely relate. It is tough. It's very difficult. Don't let anybody tell you that breastfeeding is easy or natural or, you should have the hang of it. It's not easy. So do what you need to do to take care of yourself and then now incorporate all these other tips that you can. But remember, a fed baby is best. And if you are about to start your breastfeeding journey, just remember that it's possible and you can actually have a very positive journey.
That's true. And the one for there's no trophy as well.
There's no trophy for breastfeeding or for the number of days or months that you breastfeed. Because you can decide to breastfeed and then after 2 months you feel like it's not working for you. It's okay.
I've just remembered something and we can't leave before you tell us. You posted a video about, what was your last video? The last video you posted about breastfeeding. Is it
the
pain? Yeah. Just tell us a bit about that. Maybe there's someone who is having cracked nipples.
Yes.
Or just difficulty because
the causes of pain. So I had touched on a few earlier. So I mentioned improper latching. I mentioned the flat or inverted nipples, the infection. And then the engorgement, I talked about it. Then there's also like if you are using the wrong pump or the wrong flange size, then you're going to feel a lot of pain. And some of these things your doctor won't actually tell you because it's very interesting. We don't teach patients how to pump when they're in hospital.
Even breastfeeding.
Yes. And I think it's something really important because you can't tell me breastfeed exclusively for 6 months, knowing very well at 3 months I'm going back to work. Na haujanifunza kupump. How am I supposed to pump? How do I know how to store the milk or how to prepare? Exactly. Yes. So pumping is something that I feel really needs to be talked about more.
So we are pumping advocates.
Yes.
Okay. Sawa. Now to wrap it up, one myth, misconception you want to debunk. It doesn't have to be related to the episode.
Gosh, this is interesting. Tell us one first. I don't know if I have one off the top of my head.
Let me think about it. Oh, I think that one for that for you to actually say that you have been a successful mother, especially for the first year of life, that you have to have breastfed. It's not. And I think we've addressed that clearly.
Yes.
That as long as the baby is fed and as long as you're putting your best foot forward, if you want to breastfeed, you're trying as much as you can. But if it reaches a point where you don't have milk, you've tried everything, you don't have milk, formula is okay.
Yes,
Yeah, as long
it
as the baby is
is
fed,
fed and
that's okay.
healthy.
Yeah, because actually, guys, there are two things that babies can actually die from, especially when they're
Mm-hmm.
not feeding well:
Mm-hmm.
hypoglycemia, which
Mm-hmm.
is low blood sugar, and
Yes.
that's a silent killer, even for adults, by the way. But babies
Yes.
respond very quickly to hypoglycemia.
Sana.
And then number two is dehydration.
Dehydration,
And those are
exactly.
two things you do not want your baby, especially a newborn, an infant. You don't want them to experience that.
Yes.
Yeah.
Which actually now brings me to
Also,
my.
so now uko nayo.
Thank you.
Go on, go ahead.
When you give birth, you are advised that you need to breastfeed every 2 to 3 hours. Okay, so that's the general advice that we
yeah.
give. But remember, babies are different.
Okay.
So a better indicator of dehydration is the number of diapers that you're changing in a day, not necessarily how many times you've fed your baby. Because, like, for example, my daughter and son are very different. My daughter, I think, could feed even just 5 times a day because she used to sleep. She would sleep. She was such a
And
good
now she's
sleeper.
so active.
She would go for stretches of even 5 or 6 hours a day. So now you've missed a feeding session in between. And like my doctor used to say, don't disturb the baby's sleep, because that's when they grow. There's a lot of
Yes,
things
there's a lot of
happening when
growth,
they
yeah.
sleep. So as long as you're changing about 7 to 10 diapers in a day, then you should be okay.
Okay.
Yeah.
You said 7 to 10. I'll never forget the
Of
time.
urine.
Mine is in relation to diapers, not even
Uh-huh.
the time I went to shop for diapers for my niece.
Uh-huh.
I saw the prices and I was perplexed. Like, you need to touch your hand. Because, woo! Show me where the plate is.
Yeah.
Nionyeshe sahani iko wapi.
Itakuja.
Thank you so much, Ngendo,
You're
for joining us
welcome.
again.
Thanks for having me.
And I think it's always so nice to just listen to your journey and to just see how far you've come in terms of breastfeeding. I've listened to it from baby number 1 and then baby number 2, like just after postpartum apple,
Yes.
and then 6 months, and then a year now, a year 4 months. So
Thank
clap for
you, Guy.
yourself.
Thank you
And I
so
tell
much.
every mom, if nothing went well for you today, just remember you're raising a human being.
Yes, imagine.
Always remember that.
And it's very encouraging.
And
Thank
maybe
you.
and the fathers as well. I'm sorry, the fathers as well. Yeah, but I know moms,
Yeah.
they go through a lot of like stress just because
Yes.
like the baby is really depending on you. So you're raising a human being and you're doing a good job.
Thank you so much.
So guys, remember to like, to comment, to share, to subscribe. Is there any I've left?
I think you're good.
I think okay. And to follow Dr. Ngendo as well. Especially if you're a mom and you just want to follow this mom journey. She's a really good place to get this information. She has a great community and you can learn a lot from her.
Thank you.
Yeah, so let's say bye.
Okay.
Bye.